Stay connected. Make sure you hit the subscribe button. Tim Bennett here of the Cortland Voice, and I'm here with Dr. Robert Horowitz from Cayuga Health. Doctor, how are you today?
I'm doing great. How are you?
Good. So today, to our community, we want to touch on oncology. That is a very big topic in the area. But before we speak on oncology and how that is your specialty and whatnot, we want to hear about you. What can you tell the greater Cortland community about yourself?
Sure. So I started out in New York. I was born in Queens and did most of my training in New York and was working in the Bronx for a bit. And then I moved up to the coast of Maine and was there for 20 years and really enjoyed that. And then decided I wanted to do something different and went out to Iowa. And I was in Iowa for 3 years and really wanted to get back to the East Coast. And my wife and I moved back, and here we are.
Beautiful. Well, welcome to the area. Let me ask you this: did you do any schooling in this area, or any of the colleges in this area, or any affiliations with any of them?
I did not, but my wife did. She did some work at this. She did some training at the SUNYs, and she was familiar with the area, and she loved it. And when I told her there was an opportunity in the Finger Lakes region, she was like, "That would be wonderful. That would be where I would like to be."
Awesome. Okay. Well, welcome here today. So let me ask you this. Tell our community about oncology. It's a word that many have heard a lot, I'd say more over the last year or so, but tell us what oncology is and your role in it and what you provide.
Sure. So oncology is the treatment of cancer. Mm-hmm. And I'm a medical oncologist, so I mostly deal with the medical side of oncology. So there are also surgical oncologists and radiation oncologists, but I'm a medical oncologist. So typically I'm involved in people who are getting diagnosed with cancer, people who are getting staging after they've been diagnosed with cancer, discussing treatment plans for people with cancer. Sometimes these things might involve referral to a surgeon or to radiation oncology. They might involve things like chemotherapy, hormonal therapy, immune therapies. And then I also do some hematology, both malignant hematology, so blood cancers, and benign hematology, benign blood disorders like anemia would be a common one. So those are all things that I do.
I see. Let me ask you this. What would you say to a viewer if they felt like something was wrong with their body, or if maybe they know that cancer, they might feel 100% healthy, but cancer runs in their family? Like, what would you say to them? Like, how do they know when to come see you or another practice?
So usually what I would tell someone in that situation is usually a good person to start with would be your primary care provider.
Okay.
So that would be a good person to talk to about your general health, your family history, perhaps screening for some of the more common types of cancer, any concerns you might have about your health. And usually a primary doctor, a primary care provider, would be able to help to figure out what the problem might be. Maybe it is something related to cancer, or maybe it's related to some other health-related problem. So usually it would start with the primary care provider. So most of the patients that I'm seeing are referred to us. So I'm a specialist, so mostly primary care providers are referring patients to me if they're concerned that a problem is in the cancer area, or if somebody's been diagnosed with a cancer.
Understood. And once the referral comes, what can your Cortland Oncology office offer to the patient? Like what can they expect,
Sure, absolutely. So in Cortland, we have basically all the modalities available. So basically, if someone was coming to me as a new patient, I would review their records. Mm-hmm. I would take a history from them. I would do an examination. And then depending on the problem, there might be blood tests or scans. And most of those could hopefully be done in Cortland. Some of the more specialized tests do involve patients having to, go to Ithaca potentially, but we try and do as much as we can in Cortland, and we can do quite a lot. And then if someone, let's say, did get diagnosed with cancer and they needed treatments, we do have treatment facilities available in Cortland as well. So we can do we try and do as much as we can for people as close to where they live.
Okay, that's great. Now let me ask you this, and this is one I should have asked. So how long have you been doing this? And then also, how long have you been doing this in this area?
Sure. So I've been doing medical oncology for about 26 years, and I've been in the Ithaca area now for about 2 months.
Okay. Well, welcome, obviously. We're very welcoming here. You came right at the right time. It's apple picking season, so a lot of people love to do that. Is there any message that you would have to the Cortland community, whether it be if it's a message from the heart or from your practice, or any message you would like to leave our community with?
Sure. I would say, I'd say the most important thing is there are a lot of things that you can do to help maintain your health. And certainly there are things that you can do to try to avoid developing cancer. Sometimes people are unlucky and it just happens. But there are some things you can do to reduce your chances. Things like not smoking, things like not drinking or drinking in moderation, healthy diet, seeing your primary doctor and getting screened for all the things that you could be screened for, so that if it does happen and you do get cancer, it can hopefully be found early. So that would be I'd say the most important thing I would say to people is that a lot of our things that happen to us are not within our control, but certainly there's some things you could do to try and improve your chances of either not getting cancer or finding it early if should it happen.
Okay. Well, once again, thank you for, educating our community on everything you and your office provide. Second, I want to say welcome to the area, because once again, you said you've been here for 2 months. And to your wife, I want to say welcome back. And we look forward to continuing to work with you, and to the community. Thank you for choosing the Cortland Voice.
Oh, thank you. Everyone's been so welcoming, and thank you for the kind words.
Thank you, Doctor.
You're welcome.
Stay connected. Make sure you hit the subscribe button.